Is your MRI report actually normal? Have you recently gotten an MRI report that showed some scary findings and you weren't sure exactly what they meant? Do you have a doctor or surgeon who's recommending surgery based on your MRI reports? Or do you just have questions, maybe, about an MRI report that you recently received? So, we have so many people who come into us with questions regarding their MRI reports, especially when it's done on their back somewhere. So, we wanted to take a couple minutes to discuss MRI reports and what can be actually some normal findings on those reports. As we go along, feel free to drop a note in the comments if you have a specific question on your MRI report, and I'll try to get those answered today. Okay, so MRIs are fantastic because they can show us so many things that are actually going on inside. So when we do treatment, we can actually see a lot that's going on or feel a lot that's going on, but to actually be able to see it's a whole nother level, right? Because then we can actually see what's going on. But as with anything, there's another side to it. The MRI reports can show us things that are going on that may not be relevant to the pain you're having now. So there's been a ton of research around MRI reports in the past 5 years. And what they have found out is that if you do an MRI report on somebody, or do an MRI on somebody who is over the age of 40, then they will usually show something on their MRI report. So they'll show a herniated disc, or they'll show arthritis, or they'll show something that would be considered abnormal. Except for 80% of people show an abnormality on an MRI report, whether or not they have pain in that area. So what that means is that if you have pain or not, you may still have an abnormal MRI report. 80% chance you'll have an abnormal MRI report, except for that actually means that you're normal because you're in the 80%. So congratulations on being normal. The important thing to do is really look at the MRI report in conjunction with the clinical signs and symptoms, which is what we do during the evaluation. If you bring in your MRI, I'll be happy to look at it, but usually I'll look at it after I do the evaluation because I want to see what your body's telling me before I look at what the MRI report says, because the MRI report should only be used to confirm what I am finding clinically. So the good news is, if you have something that showed up on your MRI report, chances are you are 100% normal. If they showed a herniated disc or if they showed arthritis, chances are pretty good that that's normal. It may or may not be what's causing your pain, and we need to do a full evaluation so that we can be able to see if the clinical signs and symptoms match up with what that MRI report is saying. So I'll give you an example to illustrate this. I had a fantastic patient who I was working with who was having neck pain. And she had had neck pain for a long time. And, we were just kind of gently working through it and really trying to keep her motion so she was functional to do activities like driving and living her day-to-day life. So we had gotten into a pretty good pattern of knowing what her body needed in order to maintain her motion. She was older, but she was able to go to Tai Chi and go to the gym and take care of her grandparents and do all the things. Take care of her grandchildren and do all of the things that were important to her. So she got involved in a really bad car accident. And they ended up doing a CT scan because they were worried about a concussion. And when she came in to see me after the car accident, she said, "Amy, in my neck and my cervical spine, they found severe degenerative arthritis. And I didn't know that I had severe degenerative arthritis in my neck." Now, this is a lovely, vibrant woman who, until this point, had been driving her grandchildren to school in the morning, going to all of their soccer games, um, going to the gym every day. I mean, very busy, active, older woman. But when she came in that day, she did not look vibrant. And she was really concerned about this severe degenerative arthritis. That's actually what they wrote on the report, severe degenerative arthritis of her spine. So I said to her, listen, this did not just happen because of the car accident. This is actually what we have been treating for a couple of years now. And I knew you had it. You weren't quite aware of it because there's really no point. There's nothing we can do to change arthritis, but we can change function. And as long as we can change function and keep you doing the things you want to do, then it doesn't really matter if you have arthritis or not. And so she said, well, but I'm worried about the arthritis and trying to recover from this car accident because, of course, she's got, muscle strain and everything from the car accident as well, right? And so I said, of course, I understand that you're concerned about that. But the car accident, the issues from that will go away in 4 to 6 weeks with treatment. We can get you back to where you were before. The severe degenerative arthritis is not going to keep us from getting where you were before. Now, would I ever recommend that she become a motorcycle rider? That's probably not a good idea for her. Would I ever recommend her doing something where she's having to have something very heavy on her head for a long period of time, like a helmet or something? No, that's definitely not something I would recommend for her. Before the accident or after? However, she, before the accident, was living her life with this severe degenerative arthritis and not having it affect her on a day-to-day basis. Now, of course, that is what she was in here for treatment for, but we were able to keep it under control. We kind of kept it under wraps, so it didn't bother her on a day-to-day. So I want to encourage you, if you have got an MRI report that looks scary, findings that just really freaked you out, I would love for you to give us a call. I'd love to have you come down for a discovery visit, or we can do it online if you would prefer. And let's talk about those reports. Let's look at that MRI. Let me hear about your clinical symptoms. Let me hear your story. And then we can understand better what that report means in regards to your day-to-day life. Because yes, it's scientific. And yes, it is true. But it doesn't mean it's what is actually affecting you on a day-to-day basis. It's not necessarily what's causing your pain. And honestly, if you have something abnormal, you're normal because 80% of people do, whether or not they have pain. So I hope this encourages you today. I would love for you to give us a call and we could set up a body chat. We could find out more about your body. We can find out more about what happened on your MRI report and see if there's a consistency between the two. So if you have any questions or you'd like to set up that body chat, feel free to give us a call at 425-658-4944. We also do have a workshop coming up soon in a couple of weeks that we're going to be discussing more about this particularly. So feel free to give us a call if you would like to get signed up for that, or you'll see the form dropped into Facebook next week. All right, have a great day, everyone. Bye.